All right, so it is a minute after 3, so we're going to go ahead and get started. I want to welcome everyone to this webinar with Advocates for Ohio's Future. We're also have speakers on from the Legal Aid of Southwest Ohio and the Ohio Association of Community Health Centers. And we're here to talk about healthcare access and Medicaid in Ohio. So welcome, everyone. My name again is Will Petrick. I'm the State Director, and I'm joined here with Gail Clendenin, Communications Director with Advocates for Ohio's Future.
Hi, everyone.
Before we get started, just wanted to take a minute to talk about some housekeeping stuff for the call. One, as people have noticed, there is a chat box down in the left-hand corner. You can feel free to have conversation, comments, ask questions throughout the webinar. There will be some time at the end for questions, but feel free throughout the webinar to weigh in and use that chat box. Just a note, if there isn't enough time to address all of the questions, that chat session is recorded, so we'll definitely get back to you and respond to all the questions and connect you with the right person. One other thing to note, if you're having technical issues, if your browser for some reason isn't sharing the PowerPoint, you can try to hit the refresh button. If that doesn't work, you can just go ahead and listen in like a normal conference call. We will be sending a follow-up email to everyone who is registered, and so we'll send out a copy of the PowerPoint and some of the other materials that we talk about on the call. The other thing you should know is if you are new to Advocates for Ohio's Future, we will add you to our mailing list. You can unsubscribe from that at any time. I'm going to put my camera on so you can see me. Hey, folks. I hope you can see me. So, again, welcome. My name again is Will Petrick, and for those of you who this is your first webinar with Advocates for Ohio's Future, we are a statewide coalition of over 470 organizations across the state. We all work together to promote health and human service budget and policy solutions so that all Ohioans live better lives. One of the things that we like to talk about is, what brings us here? Why are we here? What are our values? What are our shared beliefs? So when we think about our work, the thing that brings us all together is that we believe that Ohio should be a great place for everyone to participate in the community. Everyone should be able to live and work, and we believe that our budget and policy priorities can actually make things better. They can make people more competitive, they can create better jobs and increase opportunities for all families and communities in Ohio. We also believe in community. We know that healthy people build strong communities. So we're here today to talk about how can we make our communities healthier. We believe that all of these different critical health and human services and early education are fundamental building blocks for healthy communities. We also believe in people and families. So we know that, if people have access to the basics, things that a lot of people on this call might take for granted, things like food, housing, transportation, healthcare, childcare. If people have all the basics, everyone can live better lives. And so, we want to make sure that we're working to strengthen families and communities and working to make sure that people have their basic needs met. Finally, we also believe in participation. We're so glad that so many of you have showed up today to participate in this webinar. We believe in democracy, and we believe that the more people that are involved in the conversation, the better the decisions will be, and the more responsive our state lawmakers and leaders will be. So we're glad that you're with us today. And I mentioned again that we are a statewide coalition. We have over 470 organizations across the state that have endorsed our mission and goals. And so you should be able to click on this link on your screen. If you are with an organization that has not yet endorsed Advocates for Ohio's Future, you can click that link. Or if you just want to learn more, you can go to www.advocatesforohio.org. Excuse me. So next up, Gail Clendenin is going to make a couple announcements.
Hi. I am Gail Clendenin. I'm the Communications Director at Advocates for Ohio's Future, and I'm so excited to have you all on the webinar today. We're really happy to be doing this series. I'll talk to you a little bit more about that in just a second. I wanted to let you know, though, as an announcement, that Advocates for Ohio's Future is moving. We have been on sort of the southeast corner of downtown, and we are headed to an office with our office mates, the Public Children's Services Association of Ohio, to a new office about a block from the State House. We're really excited about how this puts us in range of a lot of the partners and organizations that we work with all the time, and also gives us an even greater opportunity to interact with lawmakers and really be involved in working with them on these issues that we all care about. Our address is on your screen in front of you, but everything else about us, the phone numbers, the emails, are all staying the same, so hopefully we won't fall out of contact. We are so excited to have this new monthly webinar series. We just started it in September, and our goal with these is to really help you take action for strong families and for strong communities in a lot of different issue areas. So I know that many of you are really involved in this work around Medicaid, around healthcare and healthcare access. We hope that you will stick with us when we deal with other advocacy topics, because as a coalition, it takes not just effort in one area of health and human services, it takes effort across a whole spectrum to really move the condition of families and communities in our state forward. Our goals with these webinars are to help you take action, to give you the resources that you need to do that and to be informed, and to give you some updates on what's happening at the state level, especially as we dive into the state budget coming up in early 2015.
Great. Thanks, Gail. And before I talk a little bit more about the agenda for the meeting today and introduce our speakers, I actually wanted to get a sense of everyone who's on the call, get a sense of your involvement in the effort to expand Medicaid last year. So I have a couple polls. First question is, were you involved in a Medicaid coalition? It can be a local coalition, a regional coalition, a statewide coalition. People can weigh in, submit your vote. Thanks everyone for weighing in and voting. It looks like about 50, a little over 50% of the people on this call have been involved in a Medicaid coalition, either at the local or state level, and about 45% were not involved. All right, so for the next poll, question about whether or not you took some kind of action related to asking lawmakers to support Medicaid expansion during the last budget process, or even after that when there was collecting a petition. You know, did you call your lawmaker? Did you attend a community event? Did you attend a rally? Did you take any kind of action last year? So I'm on my screen, and unfortunately, I'm trying to show everyone the results. Oh, people can see the results. So it looks like 67% of people made some kind of action in the last year around Medicaid, and about 33% of people have yet to do that. I would actually consider this a community event that's related to Medicaid. So, you know, after being on this webinar, 100% of people on this call have been involved in a community event. So the last question is, do you work directly with Ohioans who participate in Medicaid, or do you know anyone who participates in the Medicaid program? Wow, so it looks like a large majority of people who are on this call work directly with Ohioans who participate in the Medicaid program. So you all are really connected to the value and the benefit of healthcare access and healthcare coverage. Wow, it's amazing to see. 97% of people work directly with Ohioans who participate in Medicaid. All right, well, it's really fun to get a sense of the room. So just wanted to give everyone a sense of, what's the purpose of this webinar. So we're here today again to update you all on healthcare access and Medicaid in Ohio. So the decision that was made last year to expand Medicaid up to 138% of the federal poverty level made healthcare available to more Ohioans than ever before. But we still have a lot of work to do as we look forward to the next state budget. So during this webinar, we're going to talk about or get an update on enrollment and healthcare access in Ohio. We're going to talk about what's next for the Medicaid program. We're going to talk about personal stories and why personal stories are critical in advocacy efforts. We're also going to share ways to get more involved to keep Ohio's families and communities healthy in the coming months. So we're really glad to have a couple amazing statewide advocates as guest speakers today. We have Owens, who's the co-chair of Advocates for Ohio's Future and also senior attorney with the Legal Aid of Southwest Ohio, and Julie DiRossi King, I don't think she's the executive director, but sorry, Julie. Yeah, COO of the Ohio Association of Community Health Centers. So to begin, Owens is going to talk a little bit about just the history and the context of where we're coming from.
Well, thanks a lot, Will, and it's great to be with all these good people this afternoon. I just have a couple of minutes here to look back because we're going to be spending most of our time looking at where we are now and how we're going to move forward. Everybody knows, I'm sure, the story of how this unfolded last year. What you may or may not know is that this was a very, very high priority for Advocates for Ohio's Future last year. All of the participating organizations recognized the incredible importance of health care for the people that we serve, and it's clear from the poll we just did, wonders of technology, that almost universally everybody on this call works in serving this population in one way or another, so I'm sure you recognize that. AOF leaders, members of the steering committee, officers, and others played key roles, both in statewide coalition work and in our regional coalitions. We were members of the executive committee or steering committee of the state coalition, did a lot of communicating between the administration, members of the General Assembly, and members of the coalition. And just to remind you, this coalition was of unprecedented breadth, including business representatives, providers, people from the faith community, the nonprofit world, consumer groups, media groups. Every major publication in the state adopt editorial positions in favor of the expansion. So it was a great coalition, and AOF played a major role in it. That was also true at the regional levels, where regional coalitions did a lot of work in their communities around media, around talking with legislators, and doing a lot of education events. Let me go to the next slide. I think everybody knows that without getting into all the weediness of it, expansion was finally accomplished not through legislative action, but through action of the controlling board. Despite the just heroic efforts of this broad-based coalition, which included at the top the governor, some of the forces in the legislature, particularly in the House Republican caucus in the legislature, just were able to prevent the legislature from taking action. But I think because of the continued persistence of the governor's leadership and the coalition's continued work following the completion of the budget session, the controlling board was able to accept a proposal to authorize expending the federal funds for the expansion, and did so. Now, it's important that we all recognize, I'm just going to say it now and we'll come back to it later, that this action by the controlling board is not identical to action by the legislature itself, in that it basically is authorized to approve expenditures of federal funds between budget sessions of the legislature. And they actions that it takes sunset at the end of the next legislative session. So the action to expand Medicaid will sunset next June 30th of 2015, unless the legislature reapproves that action. And as I said, we'll say more about that later. But suffice to say, Medicaid expansion was a high priority for AOF this past year and will continue. The maintenance of our existing Medicaid program will continue to be a high priority in this coming session. Julie, I think it's to you.
Thanks, Carl.
Great, thanks, Paul, and good afternoon, everybody. I am Julie DiRossi King, and I'm the Chief Operating Officer for the Ohio Association of Community Health Centers. Although I'm sure I've probably been called worse, I am not the Executive Director, just the COO. But it's truly a pleasure to be here with all of you and my colleagues on the panel. I really do appreciate the opportunity, and I thank all of you out there for making the time to join us so we can talk about a subject very near and dear to my heart and hopefully many of yours, which is access to health care. So the mission of my association and our member health centers, as you can see, is to ensure access to care for all Ohioans through the growth and development of our community health centers. And then from the health center perspective, it's to provide that comprehensive, coordinated quality care to our medically underserved communities and vulnerable populations. We are 43 strong federally qualified health centers and FQHC lookalikes, more commonly referred to as community health centers. We have a presence, I think it's actually 206 locations in 55 of Ohio's counties. We provided care to over 565,000 Ohioans in 2013, representing well over 2 million patient visits. So that's a little bit about us. And Carl just very well talked a little bit about, like he said, taking a quick look back in 2013, which was pre-coverage reform era. We had roughly 1.5 million uninsured Ohioans who lacked health care coverage. And then under the leadership of Governor Kasich and coupled with the actions of the Controlling Board, and the Controlling Board has legislative oversight over certain capital and operating expenditures by state agencies. Ohio extended Medicaid eligibility for adults up to 138% of the federal poverty level. So for a family of three, that equates to roughly $27,000 a year. And that is effective, as Carl said, from January 2014 through June of next year, which is the end of the biennium or the next state fiscal year. A quick look of how Ohio compares to our sister states and states across the country. 28 states, including the District of Columbia, have expanded Medicaid. We have two states that we're all closely keeping our eyes on, which is Indiana and Utah, and their applications or waiver applications are currently pending. And then we do have states who have taken a pass and who have said that forthright, and that really creates some critical situations and creates a health care coverage gap for folks who are cannot afford to purchase insurance inside the marketplace, but aren't eligible for Medicaid, and it's actually really hurt some of the poorest among us. So we're very, very fortunate to be in the situation that we are. So in December of last year, benefits.ohio.gov, it opened for enrollment with coverage taking effect January 1st of this year. In the first 6 months of being live, so through the end of June 30th of this year, 2014, nearly 593,000 Ohioans were connected to Medicaid coverage, including almost 339,000 individuals who were newly eligible, which means roughly 53,000 Ohioans were previously eligible but had not yet enrolled, and then enrolled during the first half of this year. That's often referred to as the welcome mat effect or the woodwork effect, and it's fairly common when you see some expansions that there is a lot of information and awareness, and you pick up a significant part of the population that was previously eligible but not yet enrolled. So I think we can all agree and applaud Ohio's decision to extend Medicaid which is providing an opportunity for Ohioans to have healthier, more secure and productive lives. And extending this coverage is also, at the same time, stimulating Ohio's economy. And a healthy, productive workforce is one of our greatest resources in the state. So I know I'm speaking to the choir when I say families and communities thrive when we create jobs and people are working and they are healthy. My next couple of slides, oftentimes the expansion population for Medicaid is referred to as Group 8. So this is, and I have to give a shout out to the Health Policy Institute of Ohio, who worked with the Governor's Office of Health Transformation to put this slide together. And so we are strictly looking at enrollment projections and an actual enrollment for just the expansion population, which again is Group 8. And so you can see 93% of those that were projected to enroll into Medicaid by July of 2015 were already enrolled by July of 2014. So we've done a tremendous job on the Medicaid side of the equation. We still have work to do, but so that's been a breath of fresh air and then some. So that's just really great to see. And while we're focused on Medicaid, a big part of the coverage reform equation is also marketplace. And so you can see we have a lot more work to do here in Ohio of the potential market size for folks getting connected to coverage inside the marketplace. It was over 800,000 Ohioans, and we had less than 20% enrollment as of May 1st earlier this year. So a lot of work to be done there. I wanted to quickly mention Medicaid presumptive eligibility. It's a phenomenal tool, and Ohio has made great use of it. I think it has impacted our rates of enrollment into Ohio Medicaid. But presumptive eligibility, commonly referred to as PE, is used by states across the country to connect consumers immediately so they can access needed health services, and you can presume them eligible while their full application is going through the process for Medicaid or CHIP. And historically, we have allowed our County Department of Job and Family Services to perform PE, but a few budget cycles ago, we expanded the list in Ohio of qualified entities to include hospitals and federally qualified health centers. And then in 2014, there was a provision in the ACA that said hospitals would be able to deliver PE to all folks who are eligible for Medicaid. And Ohio was the first state in the country to expand the list to include also federally qualified health centers. So it's still at the county level, and now our hospitals and our FQHCs are able to presume Ohioans eligible for Medicaid as appropriate while their full application is pending. And historically, again, it's been limited on who could do that, and it was just categorical in nature, so just for pregnant women or children. But now this is for everybody. And speaking on behalf of my membership, I know firsthand that that's been a phenomenal tool to connect Ohioans to coverage immediately. Ohio Enrollment Coalitions, there is the Ohio Network for Health Coverage and Enrollment, which is referred to as ONCE, and that ensures outreach and education enrollment efforts in Ohio are coordinated and effective. There's statewide, regional, and local organizations around the table that participate in that strong collaboration. It's really been a phenomenal effort. Their website address is listed there on the slide. And if you're not familiar with ONCE, I believe I heard just earlier today that they're over 300 strong. I encourage you to visit the website and or plug in if that's something of interest to you. They're a phenomenal organization. And then I know there are regional coalitions for local sisters in the major metropolitan areas, and I'm sure many more. And if folks need or additional contact information, don't hesitate to ask, and we can connect you appropriately. So a quick snapshot of Ohio's consumer assisters. I believe last year we had 3 organizations that received a Navigator grant, resulting in 75 individuals or more here in the state. We have approximately 450 certified application counselors in the state of Ohio, and of those 450, 300 were providing services at our federally qualified health centers who received funding from the federal government to provide outreach enrollment assistance, free in-person enrollment assistance to our existing patient population, but also outreach into the general community. And I know just in the first 6 months from the health center perspective, the FQHC perspective, there were over 115,000 consumer assists, and so that's something we were real proud of. But we also have our County Department of Job and Family Services who have so much going on, but they're also working with us to assist Ohioans and get them connected to coverage, as well as Ohio's managed care plans, Medicaid managed care plans. We have 5 statewide plans, and they are doing their fair share as well of getting folks connected to coverage. I'll go quickly through this slide, but the role of our FQHC certified application counselors to raise awareness and provide that free in-person enrollment assistance, not only to our existing patient population, but again to the community at large. And there's a lot of data that shows that one-on-one enrollment assistance really goes far and has a direct correlation to increased rates of enrollment. And so I think we'll talk here in a little bit about some of the harder to reach populations, and definitely having a trusted messenger or being a trusted member of the community goes a long way to reaching and working with folks. I know we saw in our network, our health center network of outreach and enrollment staff, that on average it took about 3 touches with the patient or the member of the community to actually complete the enrollment process. So you're building a relationship and educating and conducting very valuable services that go a long way, and it may take some time for the consumer to feel comfortable to make a selection and enroll. So are eligible but not yet enrolled. The rate for uninsured Ohio adults between the ages of 18 to 64 fell pretty significantly just from where we were last year at 17% to 11% as of May of this year. But that still leaves 800,000 Ohioans without health coverage. And so kind of going back to that hard-to-reach population and needing trusted messengers for outreach, it includes all of these listed communities of color, ethnic and refugee communities, our homeless populations. It also includes, left off here, it's glaring at me right now, is into our brothers and sisters who are struggling with mental illness and into the behavioral health community. And so while we've made some significant progress, especially on the Medicaid side, we really need to look at lessons learned from last year, and especially as open enrollment years for the marketplace, you can enroll into Medicaid 24 hours a day, 7 days a week, 365 days a year, but we'll really have to look at lessons learned and reach out to some of these harder to touch populations. I think some of the common health behaviors of the newly enrolled, but for a long time they've been uninsured, and so we're seeing high rates of untreated with multiple chronic health conditions, Ohioans who have been suffering with mental illness or substance abuse, who are finally being connected to coverage. But for a long time, if they're not connected to an FQHC or a free clinic or another key provider of the safety net, many have had no other alternative than to inappropriately use the ER for primary care. So for non-emergency needs, and we all know that a lot of those could be prevented if they're connected to a comprehensive quality primary care team. And so this is a great opportunity to do that. But they're certainly left with, how is it best for them to now navigate the healthcare landscape? I've never had health insurance. I'm not sure exactly how I'm supposed to use it or what I'm supposed to do with it. So what are my next steps? And so that, I think, gives all of us on the webinar today. It's the managed care plans, it's community organizations, it's churches, it's all of us, the trusted messengers on the webinar this afternoon, health centers, other primary care providers, to use this opportunity to also educate the newly insured on how to use health care appropriately. Accessing coverage is a significant and extremely critical part of the equation, but access to a provider, to a healthcare team, is certainly the other very important prong. And so we need to increase consumer health literacy, and some of that is terminology. You know, again, they're new to them having health insurance. What is a deductible, a copay? How do I go about renewing and selecting a plan? What benefits are covered under the plan I'm going to select, and how do I find a provider, and do they take my health insurance? And how to be an active healthcare consumer, and that's not just for the newly eligible. I think many of you know my colleague here at the association, Dr. Ted Winslow. He's our Chief Medical Officer and came to us from the Ohio Department of Health. But he says all the time, 85% of us, whether we're uninsured, insured with private insurance, or with public insurance on Medicaid, we all have crap for care, and we need to be an active and informed healthcare consumer and advocate for ourselves. And so we need to make sure that our folks feel empowered and play an active role in their health care. And frankly, they also need to know, well, when is it appropriate to seek emergency care and when is it not? So we have a lot of work that we can do and great opportunities really to educate this new population that's been recently connected to coverage. So now moving forward, I'm going to, I think, turn it off to call, but we do expect and are very grateful. It is expected that the governor will propose the continuation of the extension of Medicaid in his 2016-17 biennial operating budget. That is, if Governor Kasich is reelected. And that will be introduced early next year, but how and what form such an extension will take once it's introduced and as it moves through both legislative chambers is unknown. So the House and the Senate, they will put their stamp on what is proposed, and so we have to make sure we're diligent in each part of that process. And so, again, to Carl's point, if no further action is taken by the governor and the General Assembly, funding for the Medicaid expansion population will sunset. So I hope you all will gladly join me in making sure that these newly eligible Ohioans who have been connected to health coverage don't lose that health care coverage, and that jobs won't be lost and our economy won't suffer. So I look forward to working on that with all of you. So, Carl, I believe I'm turning it back over to you.
Okay. Thanks. Actually, that was a great lead-in, Julia. So where I'm going to start is kind of where you just closed off. I said this earlier, and let me pick up there, that this controlling board action sunsets. You've heard that. That's the result of the legal structure of the board and how it operates. There's nothing to be done about that except, in this instance, to persuade the General Assembly that we need to continue our Medicaid program in its present form. And I'm going to say more a little bit in a minute about the language that we want to use. But let me kind of state to people, because I'm asked a lot, and a lot of the discussion when people really kind of focus in on the fact that this program could go away, and in fact will go away unless the legislature takes action. Well, can we go through the same scenario we went through last year? Can the controlling board do this again? And the basic answer is no. And there's really a couple of reasons, and I won't get into too much depth about it. The first is essentially political. I mean, I think the legislators let it happen last year, but I believe that at least on the House side, there still continues to be a lot of opposition to maintaining this program or continuing it in its present form, and that they would not essentially allow or would not want to allow this to happen that way again. It's also the fact that because of the difference in the amount of federal money coming into the state for this program, and this biennium, it's been all federal money for both years. So all the controlling board had to do was authorize the expenditure of that federal money. But in the next biennium, because after 3 years of federal funding at 100% level, that begins to taper down, there has to be some state dollars allocated in order to continue the program at that level, and that is something that they can't do. So we're going to have to slug this out, so to speak, in the legislature in the coming year. I think it's likely there's going to be in excess of 400 people, newly eligible enrollees by 2015, if not more. I think the original estimate was low. We'll see, but we know that we have, I think, Julie, your numbers were about 340,000. What I've seen is as of the end of August, it was 370,000. Or 367, I guess, to be more precise. And we have a very large number, somewhere in excess of 200,000 applications that have been filed that have not been decided yet. So it's pretty clear to me once they're decided, some significant number of those people will be found eligible. So we're going to have a very high number. I would estimate in excess of 400,000 newly eligible people by the time the legislature is dealing with this in the upcoming budget session. As a matter of principle, I think it just needs to be said, many of us believe and certainly hope that it's going to prove harder to take health care away from people than it was to not give it to them to begin with. Because if they didn't have it, they weren't missing something. They just continued not to have it. But if they've had it, then it's a much bigger deal to not have it. So that's sort of a principle that applies to many things in life, and we're hoping that, in fact, that principle applies here for the legislators. I mean, with that many people, pushing upwards of to 500,000 people in the state coming on to Medicaid because they're newly eligible. That is a lot of people in every legislative district in the state, and it just stands to reason that they would hear a lot from their constituents if that were to be proposed or to happen. Let me say a little bit about grassroots work with legislators. This is really key. This is, among many other reasons, why we do things like this webinar, why we try to engage, as Will mentioned at the outset, the some 470,000 applications, I'm sorry, not 1,000, but 470 organizations that are a part of Advocates for Ohio's Futures Network. Legislators are most, in the end, they are most affected by what their constituents want and what they feel is going to impact their status as a legislator and their future status as a legislator. So regional coalition work is just very critical, is completely critical to maintaining our program as we now have it. People can do a lot of things. I think Will is going to talk about stories in a few minutes, so I won't put a lot in detail in there other than to say that one of the best selling points for any program are sort of testimonials from people who've benefited from it and how it has made a significant difference in their life to have access to some service or program. So we need to be developing a lot of those stories. We need for regional activists, and that includes everybody on this webinar. If you're involved in serving these people, you can be a regional or a local activist in your community to talk to your legislators, to talk to media people, to do education work in all of the different organizations and groups that you work with and belong to about how important having this health care is for people. Julie did a great job in describing many facets of that. But in the end, we have to continue to make this case to legislators, to the public, to the media, and to people in our communities that this is a very important step forward for us as a state to building and a higher quality of life for people as well as a higher standard of living. So we need all of these pieces of work to be done, and they can best be done often at the local level. Let me say just a few words about our language. People have given this a lot of thought. We don't want to be talking about Medicaid expansion as much as we can avoid it. Now, it's going to be impossible not to ever utter those words in this ongoing dialogue we're going to have. But what we want to, the position we want to take with people is that Medicaid expansion was done. It was done by the state plan amendment that was filed, done by the work of the controlling board action. It is now built into the state budget. It is now built into the state Medicaid program. And they would have to take some affirmative action to undo that. Now, that affirmative action could be to take the money out of the budget. and or to change those eligibility criteria. But that is a change in a program that now exists and, as we've just said, is now serving hundreds of thousands of people in the state in very important ways. So we want to keep the focus on, we have a program. It's succeeding. It's serving a lot of people, and we need to keep it. And that maintenance of Medicaid as we know it is what we want to do. Now, let me just say what we want to focus on, the kind of language we want to use. Let me say a little bit about some possible alternatives that might come to the table. It's very possible, some of us think, that some legislators who may, frankly, find it difficult to think about taking the present program down or going back to a pre-expansion level to do that because they have so many constituents who've benefited from it. But they might well think, well, but we can put our handprint on this program. We can, quote unquote, reform it. Now, this word reform is a tricky word. You got to watch it. People call a lot of different things reform. And some of the ideas that have come up under the guise of reform and the legislative discussion last year and now this year is to do Medicaid in a different way. And there are some models out there. In Arkansas, they've got a waiver to put everybody into insurance using Medicaid to finance it. Somebody, I think Julie mentioned earlier, keeping her eyes on the Indiana model that's under consideration, where they would put people in health savings accounts. There are, without getting into detail, there are real problems with both of those options in terms of cost and in terms of affordability to people. But we just need to be actively involved, not only in the discussion about let's keep the program we have, but let's be careful about how people propose to change it, because a lot of these changes really are not making the program more user-friendly by recipients or participants in the program, enrollees. It can make it much harder for them, in fact, to get coverage and to keep it. So that's going to be a major focus of our work going ahead. And with that, I think I kick it back to you, Will, or...
You do.
Yes, I do. Great.
I just want to thank both of our speakers, Carl Owens, Senior Attorney with Legal Aid of Southwest Ohio, and Julie DiRossi King, Chief Operating Officer with the Ohio Association of Community Health Centers. Thank you both so much for your work and for being a part of this and sharing all this information. Also want to thank Gail Clendenin. She's sitting right next to me, but is the woman behind organizing all of this. So thanks for all of your work putting this together and bringing us all here. So I'm here to talk more about, so what's next? How do we, as we talk to lawmakers over the next few months and as we get into state budget conversations, you know, how do we talk to lawmakers and make the case that we need to continue Medicaid and continue to advance healthcare coverage and make sure that all of our families and communities are healthy. So I'm going to talk a little bit about storytelling. Many of you may have been involved in collecting stories before, but this is somewhat new in advocacy. One of the things I think to just take a step back before, you know, why using storytelling for advocacy. One of my influences is Marshall Gans. He's a professor of public policy at Harvard, and he talks about public narrative. And basically the concept of public narrative is, you know, as a leader, as someone in your community, if you're trying to either meet one-on-one with someone else or with a lawmaker or, you know, making a speech to an audience, how do we build public understanding and public support for the issues that we care about? So in this case, how do we tell a story to highlight the value of Medicaid in the state of Ohio? And so he talks about three different stories to kind of weave into that broader narrative. There's the story of self, the story of we, and the story of now. So the story of self is what we're going to be talking more about. It's basically those personal stories, anecdotal stories that emotionally move people. In the case of Medicaid, we don't want to just talk about numbers. In the state budget, we are oftentimes talking about big data and big numbers, but the personal stories really bring it home to a person in your district. How does this have an impact on that family and transforming their life? The story of we is that larger story. So it's, if you're from Cuyahoga County or Franklin County, it's the story of big picture, how does this impact the county and how does this impact the state of Ohio? Last year, there was research that came out that talked about if we do choose to expand Medicaid, that there would be 30,000 new jobs over the next 10 years, and that we'd have over 500,000 people that would have access to health care coverage that didn't before. So that big picture stuff, but connecting that with the individual story. And then the story of now is the call to action. What do we want you to do? If you're talking to a lawmaker, will you support maintaining Medicaid? So what does a story look like? We're collecting stories right now. We have a project called Ohio Speaks, where we're collecting stories of everyday Ohioans who have been impacted by different public programs, Health and Human Services, Medicaid. And so a story could look like a brief essay, 200 to 300 words. It could be a short video. It could be legislative testimony or a story in the media. If you want to check out examples of what does a story actually look like, there's actually a live link on your screen, so you can click on that link, and it'll take you to our Ohio Speaks website, and there will be a number of different stories that you can click on and read more to get a sense of what is a story, what does a story look like. One of the things that we're going to be asking everyone, and this is coming also from the statewide Medicaid Expansion Coalition. John Allison is the coordinator of that coalition, and he's working with a number of different local Medicaid coalitions and has asked all of the local coalitions to collect 10 stories by the end of November. So one of the things that we want to ask you on this webinar to help out and support this work, we're asking you to collect one story by the end of November that highlights, why Medicaid has had an impact on someone's life, or it could be on your organization. It could be from an organizational perspective, many different perspectives, and I'll go more into that. But if you are in a position to actually talk to folks who are participating in the Medicaid program, and as we saw from the survey, many of you are, working with folks that are participating in the program day in, day out. What we like to do is make sure you listen and ask good questions. So thinking about what was your health situation prior to having Medicaid, what was your employment situation like, then we also want to get the after questions. How has your situation changed, whether it's your health situation, your financial situation, your ability to care for your kids or take your kids to school? How has it made a difference in your life? Again, there's a wide variety of different perspectives. In the last state budget, there was testimony from all different sorts of people talking about how this would impact their community. So, consumers, faith-based perspectives, dentists, employers, behavioral health providers, doctors, veterans, child welfare, social workers, primary care providers, folks that are working in the criminal justice system, navigators. There are many different aspects or many different people who could provide different perspectives on why Medicaid matters to families and communities in Ohio. The other thing that we're asking you all to do, we hope that you'll join a local Medicaid advocacy coalition. So we have contact information of all the different coalitions. There's a coalition in Akron, in Southwest Ohio, in Columbus, Dayton. Have all the details. There's an upcoming meeting. Owens is actually coordinating the Southwest Ohio meeting. It's happening October 16th at 10 a.m. At Interact for Health at the Rockwood Tower. There's also going to be a meeting happening in Columbus. Kathy Levine is coordinating that. She's with UCAN Ohio. That's happening October 21st at 3 p.m. at the Ohio Hospital Association. But again, we'll send all of this information out to you. But feel free to get in touch either with the coordinators of these coalitions to find out kind of what's next and how you can get involved, or just show up to the meetings or call in. So there's also a meeting happening tomorrow. Northeast Ohio, Lauren Anthus and Marcia Levine are coordinating the Northeast Ohio Coalition. That's a call, so that's tomorrow at 9 a.m. The call-in information is right there. Southeast Ohio has a call that's happening on October 15th. So that's coming up, and it's going to be at 11 a.m. And Julie DiRossi King is coordinating that group, so feel free to RSVP with her. In Toledo, we have Tim Schneider and Barb Peedy coordinating, so feel free to be in touch with them if you're up in Northwest Ohio. So again, just to reiterate, there are a couple ways that we hope you all will take action. One, we hope you submit a healthcare story to Ohio Speaks by the end of November. So if you, I think Gail actually just submitted a link to the Ohio Speaks homepage. If you're just on our homepage for advocatesforohio.org, it's actually just on the main screen. There's Act Now, Share Your Healthcare Story, and so you can click on that link too. We also hope that, again, you'll join your regional Medicaid advocacy coalition and get more involved in this effort. So I think with that, I'm going to change the settings so folks can chat and call in their questions. The screen is...
Hey, Will, it's Julie. Just one comment on the story, capturing the story on the Advocate for Ohio's future website. There is a great, they built the website so well, and there's a great feature where the person whose story you've captured, you can identify their organization and as well as their statewide affiliation. So
all attendees are muted and may unmute themselves by pressing *6.
Sorry to interrupt you there, Julie. Are you still here? Oh. So, Julie, you might have to hit *6 because for some reason it muted you. But also, everyone now, we changed the settings, so if you do have any questions or comments, feel free to hit *6 and ask questions. But I think one of the points that Julie was making was...
Can you put up the numbers again for the calls with the passcodes? I didn't write fast enough. I think it was two screens.
Yeah, absolutely.
Thank you.
Are you
just
looking
looking
for
at Northeast Ohio.
Okay. And again, we will send a follow-up email. I guess for the Northeast meeting, it is tomorrow, so it would be good to get that info.
Thanks.
I think what Julie was about to say was on the sign-up form or the submission form, if you're sharing a story, if you are affiliated with a statewide association like the Ohio Association of Community Health Centers, or there's the Ohio Council of Behavioral Health Providers, there's UCAN Ohio, there's so many different statewide networks. But if you want to submit that and let us know who your statewide network is, we'll make sure that we let them know that you've submitted a story. One of the other things, actually, I was just at an Ohio Consumers for Health Coverage meeting yesterday, and Betsy Johnson with NAMI brought up a really good idea of, some of these stories, when you're thinking about collecting stories, some of them already exist. You don't actually have to create them. So people who actually gave testimony during the last state budget, and many of you on this call as advocates, have relationships and recruited people to give testimony. Many of those people, that was before expansion. It'd be great to just call them up and ask them about their situation and see if it has changed since Medicaid and has happened. So if folks have questions, you can hit *6 to unmute. Paul, I think you talked a little bit about not talking about Medicaid expansion, and I could see, I guess one question that might come up is, why not talk about Medicaid expansion? What are the politics behind that? Why are we shying away from that?
I'm sorry, is that question to me? I was distracted for a moment. Well, it's a fair question. And I think the answer is probably a bit self-evident, but let me just amplify it. The expansion has been, nationally speaking, controversial without question. I would remind people that in the original Affordable Care Act, it was not a state option, but the Supreme Court decision that construed the Affordable Care Act a couple of years ago read it in such a way that it made that a state option. And that produced a lot of controversy across the country. We were very fortunate here in Ohio that we wound up having it because we have health care now for hundreds of thousands of people. But there are many states, virtually I think almost half the states, if not half the states, that did not decide to go forward with the expansion. I think some of them are regretting it now because, among other things, they lost out on an awful lot of federal money. But to say nothing of the impact on their people. But it's still controversial as a concept with legislators, and I guess the simplest explanation is, or with some legislators, that to talk about it not as an expansion, which just by its very meaning means taking something and making it bigger. That we talk about, we're not trying to make it bigger. We're just trying to keep it where it is. It's sort of just, it's a bit of a psychological thing, I suppose, but it's a way of trying to say it's easier to talk about keeping this program where it is and what it is already doing than to talk about expansion, which makes it sound like we're two things. One, we're kind of refighting exactly the same thing we fought a year ago, which we don't want to portray that, and that it's trying to do something to it that we're not trying to do. It could be confusing to people. They might think we're trying to expand it yet further. So it's the thought that it would be best to just try to avoid it as much as possible.
Thanks, Carl. Are there other questions?
Yeah, my name is Francis. The question about expansion, that is too political. But the fact is that, in every program, we do have population growth. How about if by next year we have a number of people who will need access to Medicaid? How do you cater for those people?
I guess I'll take a shot at that. Well, I think let's not confuse two things here. In terms of natural population growth, whatever number of people are out there who fit under the existing eligibility levels, they would be eligible and they would be served. So that's not the problem. The problem would be if they try to actually lower the eligibility levels that have been set, which would basically kick a lot of people who are now being served by the program out of the program. It's that we're trying to avoid in terms of what we're talking about here. And as I said earlier, without repeating all that, it's thought best that we just try to avoid the concept of expansion and talk about continuing the program.
Thanks, Carl. Well, it is 4 o'clock, so I want to close up here, but just wanted to let everyone know that as we think about what's next for Advocates for Ohio's Future, we are working to gear up for the next state budget. So we're working with all of our different statewide partners to develop budget and policy priorities to make sure that families and communities are actually on a ladder up and out of poverty. And in order to build a strong economy and make sure folks have an opportunity to live a good life, we want to build support for programs and policies that help stabilize low-wage Ohioans and strengthen our workforce. So you'll be hearing more details about, how you can get involved and how you can work with Advocates for Ohio's Future to make sure that we do have strong families and communities across the state.
All right, this is Gail once again. I want to let you know that we are going to keep going with our webinar series and try to help you be ready to be grassroots advocates to the people around you and to your legislators. Next month, on November 13th, and this one's in the morning, 10 a.m., we're going to be talking about what's happening with Adult Protective Services. This is a system in Ohio that helps protect older Ohioans from neglect and abuse and gives them a way to report and deal with that if and when it happens. There's a lot going on in this system, and we're also going to be fighting to help make sure that that system works across the state in the coming state budget. So we hope that you will be a part of our grassroots network, not only to work towards strong health care, but across all of these issues that affect the health and security and lives of Ohioans. Also, stay tuned. You'll see coming through your emails from Advocates for Ohio's Future, we have been working to collect our own stories, and we have videos from a couple of Ohioans about how having access to health care has transformed their lives that we're going to be sharing with you, and we hope that you will help us share those out widely so that we can be impacting the story about health care that's being told. There's a survey that you will get as this webinar closes that helps us know how are we doing as we work on these webinars, and as we hope to have others help us continue to improve by giving us some information on what you thought about how things work today, so that we can be better than ever when we see you next time. So thanks again, and thank you to our speakers, and we will be talking to you all soon.
Thanks so much, everyone, for being here with us. Thanks again, Call Owens and Julie DiRossi King and Gail Clendenin. You guys all rock. We will see you next time.
Okay. Thanks. Bye.